also can help delivering the the pathology tubes and blood tubes and send all the blood through for the staff, can bring the iPad or tablet into the patient room so that the doctors can communicate with the patients from outside the room. So the doctors don't have to wear the full PPE to go to see patients in the room. And we also have some other technology, like the UV lighting that we mentioned is another robot that we use the UV light to help killing the virus in the patient room, not across the hospital, but on the rooms that have been the place for the COVID-19 patients to stay. Then we after they get discharged from the hospital, then we use UV light. Basically we put that UV light robot on each area. That's the thing that will be the area that patients spend most time with, such as nearby the patient.
Okay, thank you. Other measures that you've taken. I mean, this is interesting. Who should be tested? I think there's possibly some confusion around this. Like, if I've just got a fever, should I be tested? So maybe yes. I mean, if you can tell us a little bit about who you feel should be tested, that would be helpful.
I think we are a bit more strict and more stringent than what the government suggested, because we want to ensure that everyone who comes to Bangkok Hospital will be safe. So we still follow the protocol from the government as the minimum. So the temperature and signs and symptoms of the upper respiratory tract infection. We also added on some symptoms like the decreased sense of smell, altered sense of taste, and all that. Just to make sure that we covered most of the symptoms of COVID-19, including diarrhea, anorexia, fatigue, malaise. If they have any of these symptoms and they come to Bangkok Hospital headquarters here, regardless of whether they have a high risk or not, we will send them to have the swab test done for the PCR if the patients agree. And all the patients that enter into the buildings at Bangkok Hospital headquarters will have to wear the mask. If they don't have the mask, we provide a mask for them, and then we have that donation box for them to donate whatever they want to donate. But we want to ensure that everyone who walks into the building wear the mask. And let's say in this webinar we have to be here together, so we have to make sure we wear the face shoes and have to stay away at least about 1 meter to keep the physical distancing protocol active. And what we must know is that this week I think we start to have some Thai people who return, the return residents from other countries coming in. So we also provide them with the accommodation at cohort board for them to stay after they have the swab test done. They will be seen by the doctor first, so that the doctor can do the initial evaluation and then keep them in the hospital until the swab result comes back. And then we work together with the BDMS Wellness Center and Mobility Hotel of BDMS that can help keeping the patients there for 14-day quarantine time to complete that. And then we do the swab again on day 14 to make sure that they get the swab negative or not detected before we send them back to their loved ones.
Okay, thank you very much, Dr. Lee. And then we've got some nice contact information for our attendees as well. So if you've got any specific questions about seaboards or in the Chonburi, Pattaya area, Nicholas serves as Assistant Director for International Marketing. And in addition, for those of you with children, Sumitidesh has got a dedicated children's hospital at the Sinakarin campus near the airport. So that's something useful for you guys to know as well. It's actually one of the only private children's hospitals in Southeast Asia. So Nicholas, welcome. Understand one of the interesting things that you've implemented at Sumitidesh is Taito Care. Can you tell us more about that, please?
Thank you, Jim. Thank you, BDMS, for organizing this webinar. So Taito Care As you know, last year in early March, we launched the virtual hospital. So the virtual hospital is our online consultation platform. You can actually access a doctor's consultation via the web and have a free online consultation, not free online consultations, but like an online consultation. So you will first talk to a nurse, she will screen you, and then she will refer you to a doctor. And then with that doctor, you can have consultation. So originally it was meant for primary care purposes, for small emergencies. You can have access to a doctor in just a few minutes. You can access either by our line account, by our Secuhome Plus applications, or by our website. But one of the critic or weakness of online consultation is that the doctor doesn't have a lot of vital signs, a lot of information. So enter Secuhome. Secuhome is a small device that the patient has with him or with her, and can provide actually readings such as pulse, blood pressure. You can also see, it has a camera, so you can see ear, nose, and throat, a small lesion on the skin, and it's plugged into our online platform, virtual hospital platform. So the doctor will have all these readings in real time, and will be able to make a better, more accurate diagnosis.
Nice.
So this year, actually, we've donated 200 Secuhome to public hospitals as a way to help the public workers to protect them from COVID. Right. So instead of entering the room with COVID patients, especially at the start of the epidemic, yes. Then the doctors can just use Secuhome to get those information.
Very good. Use of cohort wards, we heard earlier about Bangkok Hospital's use of that. Can you tell us how that works at Secuhome, please?
So like all hospitals actually using having COVID patients, we have special sections, special wards where we isolate the COVID patients. So this is basically a standard ward that we've closed to all the other guests, and we reserve only for COVID patients. And only health personnel with specific personal protective equipment can enter those wards. Okay. So as you can see on the picture, they look like standard wards, right. But the precautions and the guidelines, as we mentioned earlier, are way more strict. Right. So you cannot have visitors. You need to be isolated, yes. And only healthcare personnel can actually enter the ward.
Similar to Bangkok Hospital.
Yeah, and we also. Thanks to Secuhome Hospital, we also use Secuhome, from Secuhome Hospital.
All right.
Yeah, it's a really good tool.
Okay. Other things that you've implemented at Secuhome, other procedures, policies, programs you've implemented. I can see on the slide we've got a couple of things here. Nicholas, tell us about.
Yes, so like Dr. Pitt alluded to, we have the RA clinic and then the fast track service. So basically, if you want to get tested, you will be going into either one of these facilities. But the RA clinic is actually for symptomatic patients. It stands for Acute Respiratory Infections Clinic. Right. So that means you already have those symptoms. And you want to be tested to rule out or confirm COVID infection. But also now you have also the fast track service. So these are for asymptomatic patients or for patients with light symptoms who wonder whether or not it's a COVID infection. Right. And you can go without entering, actually without leaving your car. It's a drive-through systems. You just go through. It's in our parking. We'll empty the parking. And then you can just get the swab test from the inside of your car. Okay. Then we ask that after this swab test, you go home and self-isolate, yes. While you're waiting for the test results.
Which takes what, 4 or 5 hours, something like that?
It's a bit longer. It's 24 hours.
Okay.
But then because it's a PCR test.
Okay.
But then after those 24 hours, we will confirm. So if it's negative, then very good. That's what we are hoping for. But if it's positive, then we'll ask you to come back to the hospitals, right. And then you'll be taken into the isolation workflow that we just discussed about.
Right. Thank you, Nicholas. Very interesting. Now let's turn to B&H Hospital. So B&H is one of the, is in fact the oldest private hospital in Thailand, and is very popular amongst expats working in Bangkok. Amelie joins us. She is an international marketing expat executive. And Amelia, I understand that B&H has moved quite quickly to implement certain COVID-19 guidelines and programs. One item that we hear about in the news a lot is antibody testing. People wanting to know, if I've caught COVID-19, will I then be immune? What do my antibodies look like? Can you tell us a little bit about the test that you've implemented at B&H for that, please?
Sure. Thank you, Tim. Thank you to BDRS team for inviting us today. So regarding the antibody test, first I would like to make clear that it's not the PCR test we have been talking about since the beginning. The PCR test is really the one you want to do in case you have symptoms. That's the one the hospital will offer you, and that's the most relevant one. The serological test, so the antibody test, is the test that will check if your body has developed antibodies. That means we can't do this test at the beginning of the infection. We will have to wait because it takes time to antibodies to develop in your body. But at day 10, this test is able to see that if you have developed antibody or not. It's a quick test. It takes about 30 minutes to get the result. It's a bit cheaper than the PCR test too. But it will be more for people who are at low risk to think that maybe they had the virus without showing any symptoms. So that could be very good in the future to maybe see which part of the population have been infected and can go out more safely, and who hasn't. We need to be careful on that because when you do this test, we can't certify that you don't have the virus at this moment. So that means we can say that, okay, you have been in contact with the virus, but we can't say that the virus is gone. Another good part of this test is that when the PCR test will stop seeing the virus after about day 20, the serological test can see the antibodies way further. So a month after, you can see that, yeah, they have been in contact with this virus or not.
Thank you. The other question we get a lot about is, I'm worried about going to the hospital right now. You know, should I be coming for a checkup? Should I be coming for my regular visit with my endocrinologist? Whatever. I understand that B&H has implemented certain programs to kind of take healthcare, some elements of outpatient healthcare, out of the hospital and into the home, so people can sort of remotely consult and do certain interesting things. So if you can fill us in on that, Amelia, that would be interesting.
Yeah, that's true, Tim. This is a lot of the inquiry we have to me. Do I need to come? I need to do my check. Do I really need to come? So what you are seeing on the screen now is our line at B&H application. This one is not new. We have been doing this application for quite a while. So the features that you are seeing now are the common features. So you can take your appointment online, you can get your medical record, your lab results, and you can check the screening that you are due to do. But I won't spend time on this because this is not the subject today. We have developed some features especially for COVID. So you can see on the top right, you will have like health information. At the moment, you have like a quick survey to see if the symptoms that you have are relevant for you to come to see the doctor or not. So you will just like 6 questionnaire. And at the end, they will tell you, okay, you have low risk, but keep monitoring, or yes, you should definitely come to see the doctor. Another feature is the telephone consultation and payment online. So that will be actually it's similar to the Sanitivage one. So it's very straightforward when you have the app. That's why if you're a B&H patient, I really recommend you to have this application because everything is much more simple. So you will go on the consultation part. You will be able to call an ambulance straight away you're really in a bad shape. Otherwise, you can call for phone consultation or video consultation. When you are on phone consultation, you will be sent to the menu, like most common disease. We will allow this phone consultation mainly for non-common disease. And you can call directly. For video consultation, it's about the same except that we need to take appointments. The appointment can as well be taken by phone or by email for those who doesn't have the app. So then you will, like when you come at the hospital, you will, the first person you will see is the nurse. She will ask you for your medical history, and she will explain you the process. You will then see the doctor, have the discussion with him, and he will give you his diagnosis, and he will prescribe medicine sometimes, not all the time. Then you will receive the invoice on your line application. You will be sent to an easy payment process. You will receive the receipt and the medication delivery status. The medication are sent freely in Bangkok at the moment in the same day.
Thank you.
There's just one more
sorry.
thing. I'm sorry. So yeah, when you have your doctor on the phone, sometimes just seeing you is not enough. So sometimes he needs some further investigation. That's why at the moment we are able to send the nurse to draw the blood, to get the samples, the needed sample, to take the blood pressure at home. Then the nurse will come back to the hospital, send the sample to the laboratory. If you have the application, you will receive the result at the same time as the doctor. And then, of course, you will have a talk with the doctor, and he will adjust the treatment if needed. Or just leave it like that.
Okay. There's the chat box, how does that work?
Yeah, so same, it's on the application, quite straightforward too. So if you have any question, that can be, okay, what time the department open, or can I just cancel my appointment? You click on it, and we have like a big team composed with nurse, marketing staff, and we are a lot handling this chat. We have some English speakers, so we can answer everyone. And we really try to fix the issues as soon as we can.
Right, okay. In the last webinar, one of the questions that came up was whether supplements to boost the immune system can help. Do you provide immune booster therapy, and if so, how does that work?
Yes, so for this supplement, the team had decided to go on the Chinese medicine. I mean, we are in Asia, and sometimes we don't use Chinese medicine enough. So here they use in their booster the reishi mushroom, which is a immune system booster, and it will help as well the white blood cell to fight infections. The phytin rice extract will help in extracting heavy metals in the body. Right. And of course the well-known vitamin C, which is an antioxidant and immune system booster too. So of course we can't guarantee 100% that will leave you free from COVID, but at least as well as eating well, sleeping well, doing exercise, that can help.
Okay, thank you very much, Amiri.
You're welcome.
Now I turn to Dr. Borowan from Payatai 2 International Hospital. Dr. Borowan joined us about a week ago to talk about the impact of coronavirus on chronic disease patients. So today, what we'd like to talk about is how Payatai 2 has taken certain steps to ensure that patients visiting the hospital for routine appointments are safe. So Dr. Borowan, the first question we've got, have you put in place any operational processes for non-COVID-19 patients to eliminate contact with patients who may be visiting Yari Service Center, particularly for inpatient as well as day surgery cases?
Sure. So thank you for having me back here again. And I know last time I was talking about COVID-19 and chronic disease patients. And as you see that the numbers of cases in Thailand is decreasing, but life must go on, and this might be our new normal. As you see at the hospital, we are talking about the telemedicine and how do we make sure that our patients do get the best medical care during this COVID pandemic. So therefore, today's talk, I will be talking about a very different topic from what I talked last time. As Tim mentioned, the Safe and Sure is our protocol that we want to talk to you today. And last time I talked a lot about people who have cerebrovascular disease, coronary artery disease, diabetes, hypertension, chronic kidney liver disease, HIV patients, COPD. Those patients who still need to get to see their doctor, who still need to continue their medications, because if they don't, this may result in severe harm or even may cause the death. So in that way, we want to make sure that you are safe coming to see our doctors here. If you have a chance to visit Phayat 2 Hospital, we have two separate buildings, Building A and B. Right now, we have the designated Building A entrance on first floor to be our AR clinic. So the whole floor is the AR clinic. That way, we can ensure that the area is spacious, the ventilation is excellent. We have a separate cashier and pharmacy. Then you won't have to contact the COVID or suspected COVID-19 cases to the rest of the hospital. If you are non-COVID patients who are coming for other things, check-up vaccines, you have a choice of entrancing at the Building B on first floor or Building A on the second floor. That's where you're getting to the parking. And regardless of which entrance you're coming in, we're trying to separate the patients into three groups. High-risk group here, I'm talking about patients that Dr. Asawin mentioned earlier, the ones who might be having the COVID-19, the ones who have history of contact or previous suspected or known COVID cases, they will be directed to the spatial pathway. So then that way we try to minimize the contact with others. However, if you're low risk group or do not know for sure whether you will be at risk or not, but you do have respiratory symptoms, you'll be directed to come to see one of our staff here right now. I'm working at the AR clinic. But if you do happen to have no other symptoms, you'll be going to the separate entrance, but you'll be screened by the nurse as well. And if you happen to have any suspected history of symptoms, you might be sent to AR clinic. And to answer your question, sorry, took me a while to get to here. There are people who say, well, I'm scheduled for colonoscopy, I need my spine surgery to be done, I have tumor, and how do I get to the hospital safely? Right. And we do have our protocols here. First is that we do have the pre-admission telemedicine by your doctor, so that way we might be able to avoid some of the non-necessary tests or any consultations that you'll be able to make ahead of time before you're coming in. Once you arrive at the hospital, we have allocated parking close to the hospital entrance. That will have the team, admitting team, that will have temperature check for you. We have the registration there. You do have a separate private elevator bringing you to your own room. And we have the COVID-19 RT-PCR test at the room. Now, why do we do the COVID-19 screening? Because our concern is the safety for potential contamination with the non-COVID and the COVID cases. So then that way for non-emergent cases, then we would do the PCR. But for the emergency, then it has to be case by case because of the emergency. The care will be provided by the designated medical staff team, because I was asked by the patients that my niece is admitted at the pediatric department. Will she be sharing the nurse with the COVID-19 team or not? But the answer is no, because that way then the reason we're doing that, that's also we'll make sure we always have a healthy team. We don't want to get into the situation where the many staff have been contacting with the COVID-19 patient and might potentially have to be in quarantine, although we don't have that case so far. So then that way we'll make sure we'll always have a healthy team to take care of you. And the last thing is that when you're done with the procedures and being ready to be discharged, the payment process will be the cashless and everything will be taken care of in your room, so then you can just leave the hospital with minimized contact with others.
Clinic Connect, what is this?
So the Clinic Connect is probably very similar to the things that others had mentioned before.
The outpatients more. Is
this
is
for the
okay.
outpatient.
Okay.
Those are for the previous one was for the inpatient.
Right.
But for patient who say, well, I have diabetes, but I do not wish to come to the hospital, or if I just have some mild symptoms, do I really need to come in or not? So we have the Clinic Connect, which we provide different types of services here. First group is for our established chronic and stable patients, because these are patients who the doctors know them very well and they still need to continue the treatment.
Right.
So we have the service including the consultation, either video call or by phone call. We send our lab technician wearing PPE to your house, drawing the blood, also do the vital signs, and thanks to Midway again for title care that we'll be using if the doctors need to do some physical examination for the patients.
Right.
And then once the discussion is done, we do deliver the medications by trusted delivery, because some medication need to be kept refrigerated. So we're working with SCG right now to deliver the medication safely to your door. This also applies for acute simple illnesses. If you just have mild diarrhea, you don't feel like you're sick and not need to come in. Regardless of whether you're chronic or acute patients, though, you will be screened by the doctors here, because unfortunately in some cases like bleeding, or if you have shortness of breath, chest pain, we would need to direct you to come to the hospital. And the last thing I want to mention here is that last talk I talked, although we don't have COVID-19 vaccine, we do have flu vaccine, and there's a case at Bamrana with our biggest infectious hospital in Thailand. That was a co-infection of influenza A and COVID-19. Therefore, I would encourage you again to get the flu vaccine. And right now, Thai 2 has a 2 vaccine programs for this. First, it's called Express Vaccine Service, where you can scan QR code. You can find out from our website or Facebook and make an appointment just one day ahead of time, make a payment, come to the hospital, get the shot, and then just leaving the hospital with being immunized. Or if you are the patients who received the vaccine in the past, you might have the option to contact the checkup center to do the whole program. Unfortunately, we cannot do this for everyone, because our safety, your safety is our first priority. So we're afraid that the patient might have developing some complications if they never have received before. So please check with the checkup center for more information.
Thank you very much, Dr. Braun. I mean, it's interesting. It seems like all of our hospitals are making a lot of use of telemedicine, both for sort of primary care, chronic and acute. And then also we're also providing a sort of second opinion teleconsultation service at a BDMS level for things like cancer, orthopedics, neuroscience, and so forth. And you can go to bdms.co.th, bdms.co.th for more information about that service. Let's now go to Phuket. And from BDMS in the south, Neil joins us. Neil is a senior manager. BDMS has 3 facilities in Phuket, as well as other hospitals in the south, such as Koh Samui, Hat Yai. Neil is a qualified RN from the US, and as I said, serves as senior manager for the BDMS southern region. So welcome, Neil. Neil, Phuket seems to have had quite a relatively high number of COVID-19 cases. It's sometimes referred to as the kind of hotspot in Thailand for COVID-19. Please tell us what steps you've taken for COVID-19, and specifically things like access, lockdown in Phuket, how do I get to the hospital? Please tell us what you've done.
Yeah, thank you, Tim, and good morning to our colleagues and to our audience. Let's share my slides first. Before playing my video, let me just give you a brief overview of our Group 6. Actually, Group 6 represents 6 hospitals, all located in the southern part of Thailand. And in Phuket alone, we have 3 hospitals, which is Bangkok Hospital Phuket. Bangkok Hospital Phuket is the tertiary care hospital and positioned as the headquarters of our southern group. And together with that, we have Bangkok City Road and the Group Hospital. Far south, we have Bangkok Hospital Hat Chai, Bangkok Hospital Samui, and Bangkok Hospital Suratani. So all in all, these are all located in the island of Phuket. And to answer your question, Tim, just prepared a short video to show to our audience all the initiative and new services that we launched since the COVID-19 started a few months ago. So let me show you the video.
In the wake of COVID-19 outbreak, Bangkok Hospital Phuket has enforced strict medical measures to cope with the current situation, with the aim to boost patients' confidence and ensure safety to all the clients. This measure consists of the following. Measure number 1. Minimize viral infections with the use of protective gear. All our medical professionals have to wear the professional protective equipment, or PPE, whereas non-clinical officers have to wear a face mask and face shields while on duty. This can help prevent the infections, along with our hospital recommendation to keep around 75 to 100 centimeters distance between passengers in an elevator. Measure number 2. Draconian disinfection in public areas and patient touchpoints. Target areas include consultation rooms, elevators, ATMs, railings, escalator, handrail, doorknobs, toilets, waiting area, wheelchair, ambulance. This can help prevent infection from physical touch and droplet transmission. Using high-quality disinfectant solution up to international standards. Measure number 3. Reorganize entrance and exit for all visitors. The single-channel policy is currently in place to control people's traffic at hospital with a clearly separated entrance and exit. Compulsory thermal scan is required for every visitor coming in, along with the screening station by our nurse team. Moreover, alcohol sanitizers are available hospital-wide. As for face masks, especially surgical masks or the green ones you may often see at the hospital, please kindly note that they will reserve for patients with medical needs in the first place. In case there are patients that fall into respiratory disease category, our hospital has clearly designed a special and isolated pathway toward the fever and acute respiratory tract infection clinic. They will be transferred by our specific vehicle, which will disinfect every time after use. Measure number 4. Medical readiness in anticipation of patients at risk of COVID-19 infection. The fever and acute respiratory tract infection clinic has been set up to provide one-stop medical services from diagnosis and x-ray to laboratory and medicine prescription. The clinic is operated by a team of medical specialists and nursing staff. Air purifiers are also in place in all the rooms in use. In case of high-risk patients, they will be taken to an isolated room, which is a negative pressure room to control infection. Measure number 5. Our policy is in place as to risk exposure or arising symptoms in medical professionals and hospital staff. Our hospital has enforced preventive measures for all staff, especially those who have traveled to high-risk countries. These include regular follow-up and reporting to our central command center via teleconference over the 14 days quarantine period. After that, there will be daily body temperature check for the next 15 days. Measure number 6. Training and knowledge circulation for medical professionals and hospital staff. We strive to equip them with up-to-date knowledge so that all the patients will receive the best of care for their health. Measure number 7. Effective reporting system for international communication. Along with our close collaboration with public health authorities, we have set up a central command center for effective communication and assurement. of the current situation, resulting in our operational realignment in good time. This is all the medical readiness at Bangkok Hospital Phuket in the wake of COVID-19 outbreak. We have a strong belief that it boosts the peace of mind for you and your loved ones whenever you step in our hospital, because your safety is our priority.
Thank you for watching the short video.
In the wake of COVID.
This is just a summary of the video, the 7 initiative or new services that we launched. But let me show you the real, actual photos. So we implemented the simulation-based guideline testing from screening to screening triads and to a PU ward until to operating room. And this is some of the actual training that we launched a few months ago to really treat all COVID patients, to make sure all our patients will be, and relatives are safe from the infection of COVID-19. And regarding the remote services, this is one of the options that we provided a few months ago to our patients, like the telemedicine or virtual consultation. And this is also the other services that we launched. It's the drive-through medicine and home delivery medicine. We found out that during this outbreak, and there's a lot of lockdown in our area, because I think some of our patients heard that Phuket is in the red zone. So these 2 services actually is becoming one of the solutions that able to help our community. We also provided the free ambulance service during the lockdown period. And right now we are increase our ambulance and drivers to accommodate the demand. And in addition with that, regarding the PPE, I think everyone heard that there's a lack of protective device. So we set a team and we were able to open a mini PPE in-house factory, which our team at the moment can produce about 200 to 300 PPE per day. And we also created our own protection shield, which is, as you could see in the picture, isolation stretcher. And also in our safety policy, we added 1 code, which is IC move code. And this code will be announced by all throughout the hospital to inform all patients and teams, especially, that there is a patient on the way from screening to PUI ward. And also, as part of the support in our community, this is just to show you one sample of our collaboration with the Thai government. With the help of Bangkok Airways, we airlifted the 52 medical team from Songkhla to assist in our second field hospital here in Phuket. We also donated few protective equipment to some government hospital in Phuket. And also, one of our hospitals, which is Bangkok Civil Hospital, we can perform our own COVID test here. And now we are helping the government hospital or the provincial hospital to do the mass COVID testing here in our area. Yes, Steve.
Thank you, Neil. That's interesting, and particularly collaboration with the Thai government as well as the local university in Phuket in terms of helping with that second field hospital in Phuket. And sounds like similar to the story with Samitibej, we're trying to help the public health system as well at this time. So that's good. Thank you very much, Neil. Now let's move to the north of Thailand. We have 2 BDMS hospitals in the north, one in Chiang Mai, the other in Chiang Rai. I'm delighted to be joined by Dr. Anjana. Dr. Anjana is a pediatric pulmonologist, and she'll tell you now a little bit more about the extra precautions Bangkok Hospital Chiang Mai has taken to fight COVID-19. Dr. Anjana, I just read actually this morning in the paper there have been no more cases of COVID-19 in Chiang Mai now for I think 14, 15 days, a long time. And also it seemed like the number of cases in Chiang Mai, it took a while before Chiang Mai became affected, longer than, for example, cases in Bangkok and Phuket. how did Bangkok Hospital Chiang Mai use that additional time at the beginning of the pandemic to kind of take extra steps to prepare for COVID-19, both in terms of patients as well as the staff using the hospital?
Right. Well, first of all, good noon to everyone, and thank you very much for the opportunity here to speak with you. To answer your question, my slide presentation will give you an overview of what we have done so far and our continuing improvement in our facility here, and ongoing improvement. Though we have not had that many cases initially, but so far we have had a lot of tourists who visited Chiang Mai since the pandemic, and we've also had them come in as what the government clarifies as a PUI, which is patient under investigation. So these, some of the implemented things that we've done in our hospital, in our facility, have been according to the CDC guidelines to make sure that we ensure the safety of those under investigations, patients under investigation, and also for the ongoing care of the non-COVID patients. So allow me to recap a few things here, and then at the end I would also like to talk about a little bit about what do we know so far among the pediatric cases all around the world and here, and what are we looking for, and what all can we do to make sure these, the health and the safety of our children. So, as per the CDC guideline, the preparedness of COVID-19 comprises of, preventing the spread of infection, being able to promptly identify and isolate those patients. At this time, luckily, there is not a major outbreak here in Thailand. We are really, really lucky, and I think the part of it is because we've had enough and ample time to prepare ourselves, to understand the disease, and be able to bring those data into work and to help us be able to care for these limited number of cases and be ready for the escalating outbreak. The most important thing is to monitor and manage our health personnel and have an effective communication going on. So, as per that mentioned guideline, our hospital has also implemented and designated an upper respiratory illness clinic, an ARI clinic, within our facility, both separated for adults and for children, for kids. And we accept phone calls, appointments, walk-in patients will be screened at a screening point at the entrance. Not only patients that are screened by taking their history and also by doing the temperature measurements, visitors are also screened. Our healthcare personnel, doctors, nurses, and all the medical staff who walks into the hospital, into the building, will be screened as well on a daily basis. There is a separate pathway to the COVID-19 treatment and checkup area for those who are under PUI, who falls under the category of PUI, where many doctors have listed earlier. And for those who just coming in with fever and respiratory illnesses, will be designated to the ARI clinic. We also have switched one of our floor to convert it into a cohort ward in order to be able to accept patients, those who are either under PUI or coming from ARI clinic and being admitted here while waiting for their lab results. So that cohort ward is equipped with a negative pressure room and to be under isolation. Not only that, we also coordinate with our local healthcare authorities here in taking care of COVID-19 patients. So we have been going back and forth with them, having cases of PUI, and also those cases in terms of setting up the healthcare and help, both helping the government when they would need us. So we are all prepared for that. And the most important thing, the other thing that's quite significant here would be the care, the ongoing care for the non-COVID patient. So Well, as I mentioned earlier, that though we have a pandemic going on of COVID-19, but the care for the non-COVID-19 patients should not lag behind. So we have to continue these cares. We've also implemented the telemedicine for a follow-up of or continuing care for patients who need that, like hypertension clinic, diabetic clinic, thyroid clinic, as well as child health supervision. We set up a telemedicine prior to them coming in for their appointment visits. Some patients who do not require to come in, we also have a home delivery for medicines. For kids who need their annual vaccinations or their as per their age group, we have a telemedicine, discuss all the things that we would always do in our clinic, but we help them with telemedicine. We shorten the duration of their stay in the hospital. So a day ahead, we'll do a teleconference and talk to them, to the parents, find out all the information we need, discuss all the plannings in terms of their diet plan, their development plan, what do we do, and so on like that. The next day when they come in for the vaccines, they can just call ahead of time, 15 minutes ahead of time. Vaccines will be prepared. As soon as they come in, check up, vaccines done, payment online, and they can leave the premises within 15 minutes. So that's something that we have guaranteed them. Not only that, for walk-in patients who are unwell due to other reasons, we maintain our usual and regular clinical hours. Another important thing is that to continue doing our elective surgery. In order to be able to do that, we also have been, well, we are quite happy and lucky that we are able to do these COVID-19 screening tests, and all the patients who are undergoing an elective surgery have complied to that. And so this will help ensure the safety of patients being admitted into the hospital in the non-COVID ward, and also the safety of our healthcare personnel as well. Now, the last thing that is really critical and important in the whole picture here is our own facility, preparing our own facility. So the time that we have been able to, for the past 2 months, in going through our, our stockpiles and maintaining adequate PPE, our masks, our usage of all these equipments for our staff, and also having this ample time has helped us making sure that all our nurses and medical authorities and people here, doctors and nurses, are all equipped, have trained in putting on and taking off PPE correctly. Because I strongly believe that if you do things correctly and safely, we all will be safe here as well. The ongoing training for staff, and we also still maintain the physical distancing and promoting a frequent hand washing culture within our facility here. Now, let's touch up upon what do we know so far between COVID-19 and our children and the health of our children. So these informations have come from, I reviewed this from CDC, and these are information that's updated until April 17th of 2020. Now, pediatric population do get infected from COVID-19 as well. No one is immune to this, so everyone is at risk. But relatively, there have been far fewer cases of COVID-19 among the children. So far in the United States, we've had only about 2% of cases. In China, 2.2% of all the confirmed cases. In Italy, 1.2%, and Spain, 0.8%. For these countries abroad, they declare children population of pediatric as under 18, whereas in Thailand, the cutoff point is under 15. Okay, let's see. Well, no, because of the limited and fewer cases, there's no clear cut in terms of their incubation period, but it's still believed to be approximately about 14 days. And of all these cases that have been reported, they have been a strong correlation with someone in the family being diagnosed with COVID-19 prior to these children being sick. So it's very important to know that it's it tends to be from adults in the family who contract COVID-19 and passes on to their children at home. Now, the clinical presentation of these children cases, now luckily, for some reason, kids all have very mild symptoms. There's been hardly any admissions in the ICU, having to intubate them. Most of the cases are very, very mild. And the symptoms include fever, runny nose, nasal congestion, cough, sore throat. Only a few number of them developed mild cases of pneumonia. Now, yes, yes, the most important thing that we can't forget is that there are a lot of people and kids as well who actually contract COVID-19, but turns out to be asymptomatic the whole time. Yeah, so there's a large population who are, and that's why we still have to continue our physical distancing. We still have to stay at home. It's really important to wash our hands thoroughly, because there is a large number of our population infected with COVID-19 that present no symptoms at all. They're not sick, and they can still spread infection. For kids, due to having, well, in general also, there's no current specific medication to treat COVID-19. In adults, they've been on trials for many medicines. Either it's an antiviral in terms of anti-HIV, or trying to use anti-malaria medicine, chloroquine, to treat this, but still we don't have a summary of which medicine would be quite effective for COVID-19. Luckily for kids, because of their mild clinical symptoms, they've largely been just needing the supportive care, anti-fever, anti-runny nose, some mucolytic to help them bring up their phlegm and clear it out, and eventually they recover. Now, I believe that there would be people who are concerned about kids who have underlying illness, such as adults. So we know for a fact that adults who have underlying illness are prone or are vulnerable for infecting and having a serious or severe COVID-19 infection. Yes, kids who have underlying illness should also be under the vulnerability of having severe cases, but excuse me, unlike influenza or RSV that we have seen in the past, that just the virus infection itself can cause exacerbation of asthma and things like that. But with COVID-19, we have not seen those pictures at all. And because of the number of kids being infected are so minimal, that we still have to wait and see and gather more information about the morbidity on kids. Whereas the good news is that the mortality also appears to be very, very low. Up until March, there's been only one pediatric death in China. Up until mid of March, there's been none in Italy or Spain. And so far, as of April 2nd, there's only been 3 deaths in the US. One of them is still under investigation, whether it's really associated with COVID-19 or was it a complications of surgery. So anyhow, it's still somewhat of a good news that our pediatric population don't get it so severe, and there's a very, very low mortality rate. Yeah, thank you.
Thank you. No, that's interesting. And a couple of the attendees sent in some questions around children and what does this mean for children and why are fewer people getting it and why is the mortality rate lower. So that's interesting. Thank you very much. Let's now turn to Cambodia. And BDMS has 2 facilities in Cambodia. And both of these are really seen as the kind of destination private hospitals for expats in the country. Dr. Virenrat is an internal medicine specialist, and she's also the head of the Royal Phnom Penh's Hospital's COVID-19 task force. And I believe that so far, Doctor, the hospital has managed around 10 cases of COVID-19. So please, Dr. Virenrat, can you walk us through the early steps you took as head of the COVID-19 task force at that hospital to prepare the hospital for COVID-19, the different governments you engaged? And I understand as well that the guidelines are slightly different in Cambodia versus Thailand, so it might be good for you to tell the attendees how things differ in Cambodia. Thank you.
Okay, so good morning. I'm Dr. Virurat from Royal Phnom Penh Hospital. Okay, so today, thanks for being here and also giving me opportunity to share my experience with you about the COVID cases in our hospital. So today I'm going to wrap up what we have doing since January 2020. And okay, so right now, as you know that in Cambodia, the workflow is quite different from Thailand. So I'm going to explain you in detail later. Okay, so for now, as on April 28th, today, Cambodia has recorded 122 cases confirmed COVID-19, which right now they are all cured. Okay, and the government has designated 25 provincial hospitals and 4 public hospitals in Phnom Penh as a quarantine and treatment centers. To clarify our position here in Cambodia, we are not the official part of the government as a treatment center of COVID-19. However, Royal Phnom Penh Hospital is the only JCI accredited hospital in Phnom Penh, and we have been working with many expats and international insurance for a long time. Since there is a record of the case, COVID-19 case in Cambodia, we have been asked from the expats or from many embassies or consular to accommodate their own citizens who are not comfortable to stay in public hospital. Even some Cambodians have asked to stay in our hospital as well. Okay, so since the first case of COVID-19 admitted in Royal Phnom Penh Hospital, we have been working with alliance with WHO team, CDC, Pasteur Institute of Cambodia, which is the laboratory unit, the biggest laboratory unit in Cambodia, and many embassies to accommodate the surge of the COVID-19 cases. Okay.
From your staff, Dr. Virurat, that's very interesting. And some staff competency as well as the physician. So how does that work?
Sorry, can you say it again?
Yes, please. Yeah, please explain how you're supporting your staff right now. This slide, please.
Oh, okay. So we also created the training program by the qualified staff from infectious department as one of the essential part of the JCI standard. We provide training to health workers on updating in clinical practice guidelines based on WHO, CDC, or Ministry of Health guidelines. And also we have a demonstration of how to wear or how to remove the personal protective equipment correctly, as known as PPE, to make sure that our staff will get the best protection. Okay, this is a sample of the case definition launched by Ministry of Health in Cambodia, which I think is quite different from Thailand now, and they're still using this one as a standard to tell who should be tested for PCR testing. And this is the treatment option that also launched from the Ministry of Health. But for your information, before we start any treatment to the patient, we will inform them with the, as you know that right now there is no any standard guidelines. So we will inform them that we have some of medicine that that many countries use it right now, but it might or it can be effective. So the patient, they have the right to take or not to take the medicine. Okay, and we have organized the system as to screening the patient, not only the patient, but everyone who enters to our hospital at the front door, by screening body temperature, by asking the patient whether they have any respiratory symptoms or not, or the history of traveling. And then we also set up the ARI service in the front door which helps to isolate the suspected case from other patients. Okay, so since we have collaborated with Pasteur Institute of Cambodia as the only laboratory unit that is approved by government to run the COVID-19 test, we are able to collect the sample from nasal and throat and then sending the specimen for PCR testing to the Pasteur. The turnaround time takes around 1 to 3 days. And soon we get the result, we will call to inform the patient and advise them about the treatment or medication as needed. Okay, so here I will explain to you the flow. This one is different from Thailand. Expert who have any questions regarding to COVID-19 in Cambodia, please, we are willing to help you. But once you are diagnosed with COVID-19 infection, firstly, you may need to go to the public hospital as a quarantine center, especially if you are not in Phnom Penh. And secondly, you need to inform your national embassy or your insurance or your tour group or anyone who can contact with the Ministry of Health to inform the formal letter and then send to Ministry of Health to ask for the permission to move you to the Royal Phnom Penh Hospital. And once you are approved, you will be transferred to Royal Phnom Penh Hospital by via public ambulance, or you can ask our ambulance to pick you up over there. Okay. Okay, and once you arrive in Royal Phnom Penh Hospital, you will be transferred via the isolation tract directly to a negative pressure room, which is located in isolation ward. And then in negative pressure room, we will provide you CCTV, vital sign screening monitor, and other stuff that you need during daily use. For CCTV and telephone, we provide you to minimize the risk. Minimize the contact time between patient and our staff, and also minimize the usage of the PPE as well. Okay, this is the isolation ward. Okay, so just to inform you that right now we have 12 negative pressure room and 8 respirator to accommodate the surge of COVID-19 patients. In case you turn into severe pneumonia or you have multi-organ failure, we will work as multidisciplinary team, including internists or pulmonologists, cardiologists, or other specialists as needed. So all 10 cases that have been admitted in Royal Phnom Penh Hospital never deteriorated into severe case that need the respirator, not death. However, life in a small room is quite difficult. Some of my patients suffer from the mental health problems, but which we can provide the teleconsultation to Bangkok headquarters to see the psychiatrist and talk by the phone and for the best care. Okay, and this is the discharge process. So once you meet the discharge criteria, like following these 3 criteria below, like no fever for more than 3 days, improvement of respiratory symptoms, or negative of PCR testing 2 consecutive times, we will inform to Ministry of Health by calling Dr. Lee Sawan, who is the leader of infectious control in Cambodia, to ask them for the permission to release the patient from the hospital. And we also contact to the embassy to prepare the immigration process in case you need to fly back to your country. So once you are being discharged, we will give you a medical certification, discharge summary, and home medication as needed. In case you live in Cambodia, after being discharged, you need to do home isolation for another 14 days. And on day 13, the government will ask you to repeat the COVID-19 test again. But if you are living abroad, I would suggest you, after you arrive home, travel back home, and then you should continue isolation at your home for another 14 days. Okay, and lastly, I want to send a message to the expat who live in Cambodia and who are listening right now. Please plan in advance in case you get COVID-19 infection in Cambodia or any other diseases. We are willing to help you through this situation. Thank you.
Thank you, Dr. Virenrat. And that's interesting because I think there's a lot of unknown about Cambodia, and now you've cleared up very nicely for the attendees the differences in Cambodia versus Thailand in terms of the overall approach to coronavirus. And it seems like there are more rules in place in Cambodia in terms of accessing the hospital. In Thailand, it appears you can basically go to a hospital. You don't need to involve the Ministry of Health, and those are early decisions, whereas in Cambodia it seems a little bit more strict around that. But thank you for that. Thank you to all of the attendees. You've sent in a number of questions for the team. And actually, as we've been going through the presentations today, we've literally had about over 100 questions that have come in. So we won't get through to all of these right now, but we'll try and answer a few. The first one I got, maybe this one, let's try you, Nicholas. If I feel I have symptoms of coronavirus, may I proceed directly to the hospital, or should I call first? I think this is a question from people who might have relatives in Europe or whatever, where you're meant to call hotlines before proceeding to the hospital. How does it work at Semitibet? Can you just go?
Well, yeah, you can go. I mean, as a hospital, we never turn away a patient.
Right.
So, but we would prefer and actually recommend that you make a phone call. The reason for that is we want to minimize the contact and exposure. So if you make a phone call, you will then be taken into the standard patient flow, and then you will be taken into care right as you arrive at the hospital. So we would prefer you make the appointment, you know where you're going, who is the doctor that will receive you, and you will save time and minimize exposure.
Okay. Similar at Bangkok Hospital?
Yeah, similar. So if you contact us first, then we have a online form and fill in the patients, right, and submit online. So we ask you the risks, right, rules. Okay.
And DNA?
Yeah, it's the same. So except that if you feel those symptoms at night, you can go directly to the ER.
Okay.
Otherwise, just the normal process, go to the ARI clinic.
Right.
And yes, a call is good too, just to let us organize ourselves.
Okay. The next question may be for you, Dr. Barawan. Do any of the viral medications that are available work for COVID-19? There's kind of mixed messages. President Trump is talking about hydrochloroquine, others are saying it doesn't work, and the ARVs for HIV, all of these things, Tamiflu. Your opinion?
Well, so far, because this is a new virus, and I would say that this is probably like a superhero virus, we've been trying with a lot of medication that used to work for MERS and SARS. Yeah. We tried the BCG vaccines that we think that it might help, TB might help. People have tried ivermectin, which is the parasite medications we use more for animals than humans. The ropinavir, ritonavir, hydroxychloroquine for the malaria has been using. The bottom line is that so far, none of the medication is proven to be very effective. And many times we have to do what we call cocktail by putting many medications together, which make it more complicated in terms of saying which one is effective or not. There are clinical trials, but so far none of them is promising.
Right.
And not only that the virus itself causes a problem, but what something called cytokine storm, we probably will hear that more. It's how the body reacts to it. We don't know why some healthy individual will develop very severe disease, but we think that it's because of how their body reacts to it. So there are medications to be used to kind of slow the body down.
Okay.
Therefore, unfortunately, none of the medications really proven, okay, this is good. So right now, the best prevention is prevent yourself from getting infection.
Right, okay. I guess it's going to take time. And I guess it's what a lot of people all around the world are working on, is like trying to develop some kind of pathway in terms of like a COVID-19 patient, what drugs should you administer when, right? And I guess right now there isn't any firm consensus on that, because everyone's just trying to do anything to treat each patient, right? Okay. Next one, I think maybe Dr. Virenrat, let's ask you this one. And this came from actually one of the attendees from Cambodia. Should I get a flu shot this year? Will it protect me from coronavirus? I think you're still on mute, Dr. Virenrat, so you might just need to unmute your speaker. Or there we go. I think we can do that. There we go. So flu shots, Dr. Virenrat.
Okay, so right now it is clearly that the flu vaccination cannot protect against the COVID-19 infection. But anyway, CDC or WHO right now, they still highly recommend anybody who have indication to get the respiratory vaccine to continue inject it like every year, such as influenza vaccine or pneumococcal vaccine, especially in elderly or in patients who have coexisting disease.
Okay, thank you. Just one question that just came up from Olivia. Pregnant women, what measures to protect pregnant women and newborn babies? Do all staff wear masks at the nursery? Do we make visitors wear masks? Do we reduce the number of visitors? Where and how are pregnant people tested for COVID before giving birth? That is a good question. I think maybe we could try Bangkok, Chiang Mai. Dr. Anjana is a pediatric pulmonologist, but possibly has a view on that. She does deal with children. So, Dr. Anjana, can you respond to this?
Yes, thank you. That's a very interesting question. Right now, what we have implemented so far is definitely a screening in terms of the history taking of all the pregnant women. They do still come in for their regular checkup and during the antenatal care. And very close to the time of delivery, or if they have to have a elective cesarean section, they will be screened for COVID-19. And then in terms of after that, when babies are born, the nursery, all the staff, like I told you earlier already, and it seems like this is universal in many private hospitals in Thailand now under the banner of BDMS, we are doing pretty much the same thing in terms of having the safety of all patients and our own staff in mind. We all we are all screened every day before coming into the facility and working. The nurses will be wearing surgical masks at all times, and frequent hand washing culture has been implemented way before the COVID-19 pandemic. So all these things put together will ensure the safety of both mother and child during their stay in our hospital. For the visitors, we have been advised and asked for the cooperation of all our patients in various sections of the hospital, such as ICU, hemodialysis unit, to have very limited visitors coming in with the patient. We only allow one visitor along with the patient. But at the nursery, we haven't done anything like that. It's still, though we still dealing with pandemic, but giving birth to a child is a joyous moment. So it should be celebrated. So I think it would be up to the family themselves how many people they limit to come in to the hospital and so on and so forth, or would they prefer celebrating that at home later on? So that would be up to them. But the other part, we do ensure their safety here in the hospital.
Thank you. That's interesting. There's a good one from Pattaya now. Why is the mortality rate in the West far higher than in the Asian countries? I think this might be one for you, Dr. Asawin. Is there possibly a different strain of coronavirus that is affecting the West more than in Asia? For example, in Singapore, 2 people per million are dying of COVID-19. In Thailand and Taiwan and Hong Kong, it's less than 1, versus 152 in the US, 276 in the UK, and 423 per million in Italy. So why are people dying so much more in the West than in Asia?
I think to answer that question, there are many factors, multiple factors involved in this, such as the cultural patterns between most of Asian countries and Western countries. That the way we practice our daily living is quite different. Such as when you greet someone in Western countries, you might hug them and kiss them on the cheeks and things. For Asian country like in Japan, they just bow. In Thailand, we just do bye. So we don't really do any sort of physical touch of that. And also with the authorization from the government, when the government implemented any policies and protocols, we tend to follow that quite strictly,
right,
without thinking about individualism or freedoms too much. So we're not going to go for a protest to get the government to release us from the lockdown. So we don't really practice that. And I believe in most of the Asian countries, and also with the elderly populations in Western world, in the developed world, people live longer, to get sort of more sick compared to young people. Like Dr. Anjana just mentioned that in the pediatric cases, they also contracted this virus, but they don't really get that sick compared to the adults or elderly. And there are so many other factors, like the number of cases, the number of people that come to have a test done. If you look at the World WHO, they actually measure in population per 1 million. The population that had tests done per 1 million populations. In the US, there are more than 20,000 cases per 1 million population. In Thailand, we do the 50. No, it's about 2,500. So it's not too bad. It's still not that high. But a lot of people already lock themselves in the place. Like my mom, she stayed home for the last couple of months already. I think that would be a bit harder in the Western world. People will lock themselves in their home.
So it seems in a way, if you get coronavirus, you're probably better off here than if you're in the West, possibly. Less crowded hospitals. Definitely from what Nicolas said earlier, access is easier. I've heard cases in the UK, you have to call the NHS and you're on hold for 2 hours before you speak to someone, and then they just tell you stay at home until the symptoms become unbearable, then you can proceed. At least here, you can come to the hospital and access.
I have to be honest that I actually feel safer to be in the hospital than to be here. Rather than going out to supermarkets or in the public places at this stage. So I usually just come to work and then go straight back home. In the morning, just come back to work again. Saturday and Sunday, most of the time, stay home. Not going out at all.
Okay. Another good one that just came up. What are the procedures when someone is confirmed that they've been infected with COVID-19? Can one be treated at a BDMS hospital, or is this a decision by the government representative, not by the individual? Yes, absolutely, they can be treated at a BDMS hospital. For every positive case, we would coordinate very, very closely with the Thai CDC, and we would definitely obtain their guidance in terms of managing this case. And this would be done, I believe, Dr. P, purely based on symptoms. So if the symptoms are mild to moderate, we possibly could say this person can be managed in a home setting, and we will continuously follow up and call them proactively.
I think in Thailand, once you've been confirmed to have COVID-19, you need to be in the hospital.
Right.
So you need to be hospitalized.
Okay.
And if you have mild to moderate symptoms, you get treated with medications according to the Ministry of Public Health guidelines came out. For the severe one, for the ICU, you need to have catheteria or all those medications that haven't been really confirmed to treat COVID-19. Just like what Dr. Morawan just mentioned, that there's no actual medication that can treat any virus really. You can't use any medications for the virus except to just reduce the replication of the virus itself.
But you can be treated in the BDMS.
You can be treated in the BDMS hospital, sure, yeah. And then if you have the swab test or the PCR test or the antibody test done in one of the BDMS hospitals, then you if the test is confirmed to be positive, then you can stay in that hospital.
Okay, okay.
You don't have to be transferred
to the government hospital. Okay. Dr. Morawan, are the elderly being worse affected in Thailand? Dr. Peake mentioned earlier, I mean, in the West, you've got an aging population, which is possibly why the mortality rate is quite high. Are the elderly also being negatively impacted by COVID-19? I mean, what are you seeing in terms of elderly people and outcomes?
In Thailand, things might be a bit different in some of the Western countries. Many elderlies are living at home with their children, and because we are taking the precautions very carefully, like I myself, if I live with my parents, when I go home, I go take a shower first, even before going to see them. We're trying not to share any regular stuff like their spoon, the plate. So I think a lot of people are aware from China population and Italy cases that elderly are being affected. So fortunately, those clusters that we see in Thailand are mostly working groups, like at middle age. So we don't see too many cases of elderly to begin with, and I think that might explain part of the reasons why the death rate is lower in Thailand. One thing I want to add with Dr. Peake here is that we all are part of this COVID-19 pandemic, and you are the best one to help prevent not spreading it. We know that social distancing is still the most important thing, and as we see not too many cases in Asian country, I believe that because we're doing that, and I want to encourage you to keep doing it, even the government might start losing the policy in terms of how you get out in the public, but the social distancing, it's my last word, that it's still very important here. I do get worried that we might get the second wave, just like some other countries that opened earlier, like Singapore or Japan. So as a doctors, we're very well prepared for this, but the situation we see in other countries, that we know that about 15–20% of the patients who get sick enough that will need hospitalization, and some might need to be end up in the ICU. If the hospital that can handle 100 cases have to handle 1,500 cases per day, there's no way that any hospital in the world can handle that. So you're part of this help as well.
So the prevention is better than cure, basically.
Yes.
That's what you should. And then the final question, and everyone's been very kind in sending these questions again, is about face masks. What is the best type of mask to use? So you have, I guess, surgical masks, cotton masks, these things. Dr. Morawan, I mean, do you have an opinion on the best type of face mask?
For me, I work in ARI clinic, so we do wear the N95, and although safety is the biggest issue for our healthcare provider, but the shortage in the world is there as well. So we do use the UV machine to try to reuse the mask we have. But for people, for expat, for anyone who are not sick, I think just the cloth mask, or if you can find surgical mask, is fine. But for the cloth mask, is fine as well. And you can search for this, but there's a chemical stuff, like some of them called Sinuso RC or BKC. You actually can mix that with distilled water. and you can spray that on top to put the extra layer on your cloth mask if you're very concerning. But if you wear mask and someone you're speaking to wearing mask and you are at least 6 feet apart, there's very, very minimal chance that you will get the infection.
Okay, thank you very much. So thank you, everyone. I think that will wrap up the question section. And as I said, we haven't been able to get to all of the questions, obviously, but we will follow up with you individually on all of those questions. So let me just summarize, and possibly you can just turn to the next slide, please, in terms of what you should do. If you've been to a high-risk country, or if you feel you've been exposed to coronavirus, you should self-isolate at home. You should contact us. Any one of our hospitals can give you advice, can give you suggestions, and they will tell you what to do. And what we've done for you here is given you very, very special email addresses, which you can contact directly. All of the hospitals here today will answer these immediately. They speak English, so no problem. You can just contact these hospitals, and also obviously by phone as well. Thank you again for your participation. And we hope that today's session was helpful to you, and we look forward to continuing to engage with the expat community in the region. Thank you.